Today we will view video clips of how to give a medication called Neupogen.
And Clarence and Judith are here to help us share their experience about how they do the injections of Neupogen.
Neupogen is a medication used to increase the number of neutrophils in your blood. Neutrophils are a type of white blood cell that surround and destroy bacteria in the body. They are very important in fighting infection. Normally, our immune system is capable of fighting infections, but if your system is compromised, as it will be throughout receiving chemotherapy, precautions are necessary. This is a common side effect of chemotherapy, and our bodies are at risk of developing infections like a cold or gastro, urine infections, pneumonia, etc. Neutropenia is when your white cells that can help fight infection are very low, and your body has difficulty fighting back. Neupogen may reduce your chance of getting an infection, but it does not prevent all infections. Well, Neupogen is a medication that stimulates the growth of neutrophils, a type of white blood cell important in the body's fight against infection. To make sure that this Neupogen is working, your doctor may ask that you have regular blood tests to assess and determine the number of neutrophils. Daily injections will begin at least 24 hours after the last day you receive chemotherapy and will continue for up to 2 weeks. The duration will vary from person to person. Neupogen should be stored in the refrigerator, but not in the freezer. It is available as a liquid in vials and is given as an injection with a small needle just under the skin. The name Neupogen should always be very clear on the vial. Make sure that the expiry date is checked. Do not use a vial after the date on the label. Remove the vial of Neupogen from the fridge about 30 minutes before use. Do not shake the vial. Assemble your supplies that you will need for the injection. You'll need the Neupogen vial. You will need 2 alcohol swabs, 1 cotton ball or a gauze pad, and a puncture-proof disposable container. And also make sure that you clean your work surface area thoroughly and wash your hands with soap and water. Choose an injection site. The 4 recommended injection sites for Neupogen are the outer area of your upper arms, your abdomen except for 2-inch area around your navel, front of your middle thighs, and upper outer areas of your buttocks. Choose a new site each time, very important, as it may not be absorbed if you use the same site all the time. And avoid any areas that are tender, red, bruised, hard, or that have scars or stretch marks.
Judith, are you able to give yourself any injections at all?
Yeah, I am. The last I was, but at first I was nervous, so I got my husband to do it on me to try.
Oh, so Clarence, you got.
So I got the experience now, yeah.
Well, that's good.
It wasn't hard. We choose to do it ourselves because of the part of going to the CLC and running and all that, you know. There's a lot of traveling. It is in the winter time, so I decided to do it myself, and it's not hard, believe me. And you're not afraid of me picking, you know?
No, not afraid because I'm used to you.
Yeah. Doesn't hurt?
No, it don't hurt.
No?
Very easy.
Okay.
Yeah.
Yeah, it takes about 6 or 7 minutes, then you're all done. Everything.
Yeah.
Good. Okay, I guess I'll have to wash my hands first before I do all this. Okay, always clean your table, your area that you're working in. It's the main thing, keep everything clean. Okay, everything's clean, table's clean. Want to keep everything onto the gauze. Make sure everything stays clean, needles, all of it. Maybe a little hard to get in these, but it's possible. And we always clean the tip, sterilize it.
So So far, so good, Clarence.
Yeah.
You're doing a great job.
Okay. Prepare one for the lady's arm.
Are we?
And putting the needle together is not very hard neither. You just push it in, turn till you hear it squeak, then you're good to go. Keep it over here. Yeah. Pull it out to about 1.5 cc. You do have to give it some air.
Push the plunger of the syringe down and inject the air from the syringe into the vial of Neupogen.
You just pull it out to 1 cc.
Getting the air bubbles out if
Yeah,
you need
getting the
it.
air bubbles out and all that, yeah.
The air in the syringe will not hurt you, but too large an air bubble can reduce your dose of Neupogen.
Just right there now, I just made sure there was no air and released it and all the liquids is all ready. She's at exactly 1 cc, so. Lay it down here for a moment. Okay, now we're just going to clean the area. Okay. That's where I cleaned it right here.
There you go.
Hold on that there.
Perfect.
I didn't make a boo-boo.
Very good.
No boo-boo. That's good.
Thank you very much, both of you,
Yeah.
for sharing this experience with us, and it's nice to know that you're going to help a lot of other people with
Yeah.
this too, so
Good.
that's good.
Good.
Yes,
Thanks
and
again.
thank you
Yeah.
very much, Helen, and the other crew helping
You're
out
very
too.
welcome. It's a pleasure.
Okay.